So Micah Joy is the third dog that has gone through our clinical trial evaluating a novel combination of radiation therapy and the use of an innate immune stimulant called CPG. Ultimately, with Micah Joy, we're trying to elicit immune response at the site of the tumor. And so we use radiation to be able to elicit what's called immunogenic cell death. Basically, radiation as a way to make the cancer cells more appetizing to the immune system. And then we give this CPG molecule right in the tumor to be able to elicit an innate immune response. The most common progression of disease for osteosarcoma is to have tumors form in the lung field that becomes life-limiting. And this is hopefully working as a vaccine effect. We're trying to amplify that immune response locally, and then the immune system can have this body-wide surveillance to keep cancer cells that have already spread from that tumor location to other parts of the body.
One of the big barriers in people with osteosarcoma is that it will take 10 years for you to run a clinical trial to know if there's a benefit because of the rarity of the tumor. Those barriers are dramatically reduced when we look at dogs with osteosarcoma, in which we have, instead of 1,000 people a year, we have 50,000 dogs a year that are affected with osteosarcoma. And the turnaround time to know if the therapy works is about a year for the dog versus 5 to 7 years in a person. I think this study is building the foundation for that first building block of, can we actually effectively stimulate the immune system with radiation and toll-like receptor 9 activation. The study is not powered, quite honestly, to show is there a dramatic effect, but it's really to lay the groundwork on, is the protocol safe? Does the protocol stimulate the immune system? And then with that information, we'd like to launch a future clinical trial in a much larger group of dogs to show, is it as effective as traditional chemotherapy?
I'm very grateful to have patients like Micah Joy and pet owners that are willing to pursue clinical trials for exploratory research where we're trying to do something big. We're trying to find something new that can benefit other dogs with this cancer and potentially humans. And I think that holds a lot of weight.